All right, I think we're live. If anyone in the chat can hear me, just push one. All right, I got a confirmation. Thank you for the confirmation. Welcome back to the Black Brain Trust. This is episode 561, Black Pandemic Talk. Please hit the like button as you come in, share the video if possible, and hit that notification bell so you get all the updates from the Black Brain Trust, including those posted on the community tab. Docket and description beneath the video for you to follow along with. If you want to engage in this discussion, there'll be a link in the chat for you to click on. Make sure that when you click on the link that you raise your hand so that one of us can acknowledge you and advance you to the panel. Just as an FYI, there is a new Zoom update that came out this week. 5.1.0. So make sure you update your Zoom client before you even try to join the panel. Let me grab the link for you all and then we'll get started. All right, man, let me get started with the first item on the docket. Actually, let me close the windows, man, because fireworks about to start to go off. Let me give a shout out to people who showed up in the chat first. Neon Eyes, good evening to you. It's evening here, so I'm not sure if you're where you're getting morning from. But good evening to you. Isaac of Olympia, peace to you as well. DE Raptor Shalom. Dorian Ann's peace. Thai City, peace to you as well. Six Le Mans 10. Yo, peace to you. Jordan Bevel, peace. Mike Shinnery, peace. All right, let's get started, man, because we're already running behind. All right, this first item is from TechCrunch. IoT solutions are enabling physical distancing. I'm not going to read this whole thing. I don't know a lot of time. If you're a business owner or investor and are wondering about the long-term impacts of the COVID-19 pandemic on the business world, you're not alone. Today's business leaders have been plunged into the deep end of telecommuting with little notice, and the way we do business has been impacted at almost every level. Travel is restricted, meetings are virtual, and delivery of goods and even raw materials is being delayed. While some industries that depend on large gatherings are seeing extremely difficult challenges due to the pandemic, others, such as the tech industry, see the opportunity and responsibility for innovation and growth. As many states begin phased reopening, companies are trying to determine what the workplace and business environment will look like in a post-quarantine world. The first obvious step is the integration of personal protective equipment, PPE. Sanitation and face masks will become required, and non-essential face-to-face meetings will be a thing of the past, along with shaking hands. Additionally, relationship-driven careers such as sales and recruiting will have to find new ways to connect to be successful. Physical distancing rules will have to be established, which may include employees coming in alternate days while telecommuting the other days of the week to keep offices at reduced capacity. Large offices of 10 or more may implement their thermographic camera technology for fever screening or other real-time technology-based health screenings. One thing for sure, IoT devices that enable physical distancing will become an integral part of reopening businesses, facilitating sales connections, and embracing a different way of living. Yeah, this is true. We're supposed to go back in the office on Friday, but I can tell you right now, a whole lot of people don't want to go back in there. Okay. There are a variety of IoT devices available that can help business leaders successfully implement physical distancing in their offices. Thermographic camera technology coupled with facial recognition can create a baseline for each employee and then assist in determining if an employee has a temperature outside their norm. Other remote health monitoring may also take place with healthcare providers, helping employees determine on a daily basis if they are well enough to go into work. While employees may have good intentions, remembering to physical distance and maintain 6 feet of distance between themselves and their coworkers can be challenging. 3D counting cameras combined with capacity status display and alarms can help enforce physical distancing and occupancy rules in common areas such as conference and break rooms, with telecommuting being the current norm and possibly extended into post-quarantine practices. Secure remote asset access. Helpful peripheral and connectivity devices will be imperative to resuming normal operations. Some companies may even find drones useful for surveillance and monitoring of outside areas. Finally, IoT devices may be integrated to retrofit legacy products to add remote communications features. I saw in Atlanta they were using drones to monitor people on the street, so that's already here. The whole purpose of the quarantine and physical distancing was to flatten the curve, and now many states have moved on to minimizing further exposure that may cause what healthcare professionals are referring to as a second wave. IoT devices and technology will be vital tools in preventing a large second wave of infections. IoT solutions such as thermographic cameras and facial recognition will help with earlier detection of people who have fevers or showing COVID-19 symptoms. These everyday health screenings can have a big impact on overall wellness of your workforce. By using IoT solutions to monitor capacity and enforce physical distancing, we can exponentially reduce the number of people coming in contact with one another, therefore minimizing the spread if the virus does have a resurgence. Additionally, IoT solutions have been key in enabling work from home capabilities, removing those employees from the risk of contact in the office. At this point, I don't see any real reason for people to go back into the office unless it's absolutely necessary, okay? Unless it's absolutely necessary. There's no real reason for anyone to go back in the office. If you can work from home, that's the business now. Going into the office, not the business. Who the hell wants to go into an office and be inside of a conference room with mask on their face? For what? What's the value of that? Okay? What's the value of that? What are we gaining by being in the office? If we can't even really if we can't shake hands and we can't be in the same room with each other, what the hell's the point? What, because the company wants to maintain access to their physical facilities that they spent a lot of money on? Hey, well, if your work culture, your corporate culture can be disrupted that easily by an illness, then it wasn't sound to begin with, okay? It was not sound to begin with. And I think a lot of companies are starting to figure out now that they have to rethink about their corporate culture. Okay, but what this opens up is they're now monitoring employees who work from home. I know some companies are saying you got to keep your webcam on all day long. I'm sorry, but that's too intrusive. We have the Fourth Amendment in this country, which is the right to privacy. You can't be peering into people's business, business in their own house, while they work from home. That's intrusive. So this is not, this is, the constitutional amendments, and a pandemic can disrupt culture. To me, you don't have a solid culture at that point. You should really rethink this. I know a lot of companies are saying, when the pandemic ends, we're gonna have people come back into the office. Yeah, right. You're gonna have to pay people more. Okay. If people are working from home just fine, then there really is no reason to go back into the office. What are you gonna come back in the office and do what? All this social distancing and things like that have to be set up. This pandemic is not going to go away by September or November or something like that. No, this is going to be here until at least 2022. Okay. This is going to be going on until at least 2022. Companies have to rethink how they do business, man. They have to rethink this. Whatever corporate culture that you had before, you can shove it. The pandemic has come and it has already taken its position and said, your culture is fragile. We can disrupt it easily, okay? Mm-hmm. We'll move on to the next item on the docket. Oh, let me advance this other person. Make sure you raise your hand before you try to join the panel. If I don't see you, you're gonna be sitting there for a while. What's going on, Perfect Blackness? All right. All right, this is from the sfgate.com. Study 100% face mask use could crush second, third COVID-19 wave. Okay. We've all heard it many times. Wear a face covering indoors, outdoors, on trains, and buses, at work, in the supermarket, and at church. But now, a new modeling study out of Cambridge and Greenwich University suggests that face masks may be even more important than originally thought in preventing future outbreaks of the new coronavirus. To ward off resurgences, the reproduction number of the virus needs to drop below 1 knot. Researchers don't believe that's achievable with lockdowns alone. However, a combination of lockdowns and widespread mask compliance might do the trick, they say. We show that when face masks are used by the public all the time, not just from when symptoms first appear, the effective reproduction number reading can be decreased below 1, leading to the mitigation of the epidemic spread. The scientists wrote in the paper published Wednesday by the Proceedings of the Royal Society. So, yeah, I mean, this is common sense, right? I mean, people should be wearing their masks, but you would be surprised how many people are black people are just walking around without wearing their mask. Okay. Guys running around with, do-rags wrapped around their face, bandanas, man, looking like Yosemite Sam out there. They're just not doing what they're supposed to be doing, man. You got a gold chain on your neck, new pair of Jordans, but you can't afford to buy a mask. I find that to be very questionable. Okay. We got Nicole 11 on the panel, man.
Hey, Mike, how you doing, man? What's going on?
I'm chilling, man. Chilling.
Yeah, Yosemite Sam, that's pretty funny. yeah, and that's not really doing much protection. You can still spread it that way and actually catch it. So, yeah, masks are pretty important. Looks like one of my friends is out in Arizona. It seems like that things have been ramping up more there, where more infections have been actually happening. So we have some states that are catching a rise in this, and New York seems to be holding okay, but I'm suspecting after these protests and so forth, we might see this stuff start to rise again. So let's just see.
Yeah. And speaking of masks, let's look at this one from MarketWatch.com. Why do so many Americans refuse to wear face masks? Politics is part of it, but only part. Americans are really up in arms when they see signs that require them to wear shoes or shirts because abiding by those standards is part of our culture, says NYU expert. When Delaware International Speedway, a raceway in Del Mar, Delaware, reopened to spectators earlier this month, attendees were forewarned that they had to wear face masks. As part of the agreement for opening with the state of Delaware, those social distancing measures are still in place, as well as masks must be worn by all spectators according to the stadium's official policy. However, pictures from the first race held on June 6th showed that many spectators did not abide by the face mask requirement. Delaware International Speedway did not respond to the Market Watch's request for a comment. In early April, the U.S. Centers for Disease Control and Prevention recommended that Americans wear a face cloth covering or mask in places where it is difficult to social distance from other people. However, there currently is no federal mandate to wear face coverings, nor is the wearing of eye protection a formal recommendation, though a study published in The Lancet found an association with reduced infection. Individual states, including Delaware, New York, Virginia, and Illinois, require citizens to wear masks in public places. Other states require essential business employees and patrons while on premises to wear masks, while some only require employees to wear them. Meanwhile, many states don't have any mask requirements and instead recommend that they be worn in public places. But even in states with mask mandates, Americans are defying these orders despite evidence that suggests that widespread use of face masks can greatly limit the transmission of the coronavirus, which is believed to occur mainly from respiratory droplets. Ultimately, it is a choice we make. And I hope it's made based on the best available current science and a desire to do all we can to help others and ourselves, our communities. He said in a subsequent tweet, like vaccines, the more who participate, the greater the impact. It may go beyond politics. In times of heightened uncertainty, humans tend to seek a sense of belonging, said David Abrams, a professor of social and behavioral sciences at the NYU School of Global Public Health. That cuts both ways. Those who don't wear masks may feel a sense of solidarity, and those that do likely regard it as an act of altruism and a way of helping each other out, said Abrams. People who have lost a loved one to the coronavirus are also more likely to wear masks, he said. Thinking about real people and personalizing coronavirus gets at the emotion of altruism and nurturance. You side with the tribe that wears the mask and you go, oh, I want to be a part of that. If common sense prevailed, all Americans would wear face masks, Abrams told Market Watch. But in light of heightened uncertainty, strong emotions override rationality. And we look to leaders for guidance. Notably, President Donald Trump and Vice President Mike Pence have been reluctant to wear and have refused to wear masks in public, and in Trump's case, to bristle at the sight of people wearing face coverings, or even in some instances to practice social distancing in his presence. Pence violated the standards of the Mayo Clinic in Minnesota and did not wear one during an April visit when he met with staff patients. People look at Pence at the Mayo Clinic and say, well, he's in the hospital and didn't wear a mask. Why should I? Pence and Trump both appeared to blame testing in the US for a recent rise of COVID-19 cases. Pence, on a Monday call with governors, actively encouraged the echoing of a Trump administration stance that the increase in cases is due to an increase in testing. The administration's argument that less testing means fewer COVID-19 cases exist is absurd, countered Kyle Herrick, president of the nonpartisan advocacy group Accountable US. So I'm not going to read this whole thing, but you know, most of these people that are that this article is kind of referring to is really Mazungas don't want to do anything. Then it doesn't surprise me. A lot of Mazungas don't like to bathe, so not wearing the mask is just par for the course. You know, I'm not surprised, man. I'm not surprised at all. But there is a difference in between who wears a mask and who doesn't in terms of socioeconomics. Okay? People who are poorer or come from a low income demographic tend to have face cloths, but people who are in the middle and upper class, they tend to have very specific N95 masks, is what I see. Okay, very specific masks. You were going to say something, Nagon?
Yeah, I was also going to say, listen to Trump and how they're blaming stuff on people. I think the biggest thing about this pandemic was to really hit it from a early response perspective or early response kind of program, like some of the other countries had that seemed to be having a better result. We didn't have the proper response. I was just watching something on Frontline just earlier today where I saw Trump at a rally, and this was in February. I don't know where he was. I think he was maybe in Vegas or someplace, saying that the Democrats were politicizing COVID and that it wasn't even an issue. He was saying they were politicizing it, and this was a hoax. So if you have that coming down from your leadership saying it was a hoax, and now you're seeing some of the responses, just some people out here who still believe this is somewhat of a hoax or somewhat of somehow a scam. I don't know why people are thinking that, but as I started to look back on this, it started to make some sense to me. Okay, people may be thinking this is a hoax because their president said this was a hoax. So maybe that's where some of this is coming from. So they tend to say the fish rots from the head down, and I think that's kind of what we're a little bit of what we're saying. Poor response. President saying the Democrats politicized this. You try to make a political issue out of it, and saying it was a hoax, and now people are kind of lax with everything that's going on. And I just don't think mentally we have really wrapped up our minds around this. Those who've had family members who've gotten sick, who have passed on, they know how real this is. But others, I don't know. I look at people in Arizona, a good friend there, and he's there, and we talk on a regular and consistent basis. And, he was saying he was going to some Costco and a few other places, and people were walking around in there without masks. And now they're requiring you to walk in the store with masks, but now all of a sudden the numbers have risen very quickly. So there's a lot of, not only do I say misinformation, but I do think that the wrong tone has been set for this. I don't know, even here in New York, it's funny, I walk up and down my street, I see people walking up and down here without masks on with other people while they're with them. They don't have masks on. I'm just strange.
It's
very strange.
It's unbelievable some of the stuff that we're seeing out here. Like I said last week, I saw a guy with a hole in his mask so he could smoke his cigarette, man.
That's unbelievable. And we know that, COVID has hit smokers harder just because it compromises the lungs more. But I just don't know, man. I'm just looking at some of the saying. This has been a terrible dropping of the ball here in this country. And if we do have a very virulent second round, I really hate to see what that's going to look like.
I remember, Dr. Phoenix and the Black Brain Trust has been covering this since December. So since 2019, we've been covering this. there were some people in the manosphere. I won't say who, and I won't say where I heard it. Okay, I was on the panel, and one of these guys, a couple of these guys said, this is a hoax. This is nothing real. It's all made up by the government, blah, 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 blah. That was January, February, okay? Come late March, early April, we start seeing these cases, people dropping like flies. Those same guys changed their screen names and everything. Nowhere to be found. All right, let me jump
No,
to this.
no surprise to me. That's not a surprise.
Yeah, and they're scared to come to the brain trust too. Scared to get on the panel. Scared to come into the chat. But these are the same people who don't believe in space, man. They say space doesn't exist. So let me jump to the next.
What did they say? What did they say? I'm sorry, I was preoccupied.
No. They were just saying that the this is back in January. That the COVID-19 was a hoax and it was made up and just this.
Oh yeah. I heard people say that.
Yeah. Now we're late March, early April, May. We're looking at the first impact of it, and these same people, they're not showing up now. Okay, so they change the screen names and everything. They think that they can hide from it. So, anyways, let me go to the next item on the docket from NBCNews.com. China reports highest coronavirus case rise for 2 months as lockdowns ease globally. Parts of Beijing remain under wartime lockdown after a new outbreak at a market. Okay. China, let me bring in these other people. China reported its highest daily rise in new coronavirus cases for 2 months Sunday as parts of the capital, Beijing, remain under lockdown following an outbreak at a wholesale market. Health officials reported 57 new cases less than 24 hours after one district put itself on a wartime footing Saturday, following a cluster of around 50 infections at the Zenfadi market. The cluster, the capital's first locally transmitted cases in nearly 2 months, raised mainland China's total number to 83,132. Almost 4,700 people have died in China, where the pandemic originated in December. Infections in South Korea are also on the rise after lockdowns were eased because of highly praised testing and tracing campaign. Health officials reported 34 more cases Sunday, adding to a recent upward trend. The country has reported 12,085 cases. Officials said 30 were in the Greater Seoul area, where half the country's 51 million people live. The new cases have been linked to nightclub goers, church services, and e-commerce warehouses and door-to-door sellers. As a result, the government has started to retighten preventative measures, pleading with the public to wear masks and avoid attending public meetings. You got these Mazungas going to NASCAR rallies, with no mask on. I just think about this.
I mean, there's a psychosis going on. There's some of these people are just, I don't, there's an old term that they used to call "you can't fix crazy," and I just think some of these people are just nuts. I'm just, I don't know what else to say, but I think this country, people are just crazy here, and reason why China and them have had such good responses is because they've had, had such pretty good results because they have had really great response that really looked out for the people. We don't have that, and you have a bunch of crazies running around. I understand why people are nuts. I at a certain level, just how we're operating now, I understand some of this absolute madness because some of this is just craziness. You're out at a rally with nobody. Oh man, it's just
not just at a rally, a race where the fumes, the exhaust from the vehicles are actually just as toxic as the virus itself.
These guys are crazy. These guys are stone cold insane. Crazy.
Mazungas. Elsewhere, the pandemic raged in South America and India. With almost 43,000 deaths, Brazil is second only to the US, according to Johns Hopkins University data. and you got people running around with no masks, no traps, no rhomboids, no delts.
And they opened up a Copacabana beach,
Yeah.
and I've got a lady down there. We talk, and she says the beach is open. I said, Margaret, please don't go out there.
Yeah.
Don't go out, chill.
Eh,
Don't go running
Well,
out to the beach.
here in Chicago, that's they got them on packed buses with no masks and
Oh,
across the street and barbecues and everything.
it's unbelievable, man. We got Judgezilla and DE Raptor on the panel. So Judgezilla has his hand raised. Let's go.
Judge Zilla, what's up,
What's up,
baby?
Judge?
Hey, what's happening? What's happening, y'all?
Right, Shalom.
That's that. See that article. The last article is very interesting. Very interesting to me on actually several levels. Um, okay, so again, we know. I think most of us here know where my Hail Cybertron reference started and came from. Right? It virtually came from the beginning of this COVID stuff in February. Right? As I was confirming information with Dr. Phoenix on this very channel. Hail Cybertron came from another channel, but nonetheless, okay. So it's interesting. That article is interesting. The last article is interesting because it's an NBC article that is also attributing the origin spot to Wuhan, China, while also neglecting to illustrate the difference between a relatively free society and an authoritarian society, and how those things could be managed differently, right? So yes, you can say that there's praise for the Chinese response, but the Chinese response gives you two options: do it or get hurt. That's the Chinese that's the response from the public. That those are the two choices that the public has in China.
Yeah.
Yeah, that is true, because I saw one reporter. You're dead on the money. I was watching this one. It was a YouTube video. I think the name of the video was The Corporation. I think that was the name of the video, but I'm forgetting it. But they had the whole thing going on in China, and they had actually a reporter who had gone into the emergency room with a hidden camera and had shown, even though that the Chinese had a very good response.
They're going. 1 second. Hey, Mike, check your right hand corner. I don't know if you want that showing.
My right hand corner.
Top right hand corner.
Oh, I don't.
Okay.
Yeah,
Just giving you the heads up there.
all right.
And I was just saying that they were in the emergency room, and you weren't supposed to have that film showing, but they did have that film showing, and it had he did it in an undercover way, and you saw people who were definitely panicking, and they were people, I'm in here for a whole day and I'm not getting treated, and I got 107 fever, and people had all kind of fevers and stuff sitting there, so shit was real hectic in there. And he had posted this. He had put this up on, I guess it was on a dark web or whatever, through China, and he put it up, and it got posted on a Facebook, and then went all over the place. And next thing you know, you saw the guy that was, the dude who was doing the documentary went to the door of the of this reporter, and the government goons were knocking down this guy's door, saying, "Open the door, you better come out, or we're coming in." Government goons were there, man. They grabbed this guy and snatched him up and bottled him up, man, like they bottled his ass up and took his ass on out of there.
Like I said, the juxtaposition I was pushing is NBC is a left leaning, right? Is left leaning, but they're praising authoritarians. That's a dangerous commingler. Look, I'm neither red nor blue, but that's a dangerous commingler.
Yeah, China's very authoritarian. I understand you. I hear you on that.
But in India, if you didn't have a mask on, you broke curfew, man. They out there beating people with.
Yes.
They beat you down.
Yes.
I mean, there's been a lot of violence behind this. Yeah.
Yes. Okay. And then to going to the mask situation, right? Because there's so much, again, just like initially with all the misinformation that was out there, right? most of us who passed biology, who passed science, who, hell, even if you had home ec and you passed that, right? Home ec told you that you could, home ec taught you how to cook things and make things at home, while also understanding that the things that you buy in the store are probably going to be better than right. If you make your clothes at home, the clothes that you buy in the store are probably going to be better. Right? So making your own mask, right? It's effective in a way, but it's effective in only if you're infected, and it's effective in stubbing the transmission from you to others. The reason being, right? The science behind this is this: when you breathe, right? Um, when you breathe water vapor. I understand. What are you talking about? I can't see it. Yes, it's microscopic water vapor, right? When you exhale, that is moisture coming. It's one of the ways that you dehydrate yourself. So that barrier, right? That moisture barrier, right? Stops some after about 2 minutes worth of breathing inside that mask, makes that mask less porous for the virus or for microbes to go through that mask. Okay, that's the deal there. That's the deal. Now N95, N94, and N95 masks, they are resistant from intake and exhalation. Okay, that's the difference. So anything, right? Because we have these measurements of things called microns, right? And you, by making these masks at home or buying them from another company that's not doing them to the standards of laboratory grade equipment, or laboratory or professional grade PPE, cannot replicate this. So when you're wearing the mask, it is a protection. I'm not telling people to not wear their masks. It is a protection, but it's not a magic. It's not a talisman. You know, it's a protection, and it does help, and it's better to have that than to not have that. If you could get, especially if you can get something like that's like has what do they call that? The silver, what is it called?
Copper?
The huh?
Copper?
It's the silver. It's the antibacterial silver thing. And it's not annotated silver. It's shoot, I forget what it's called. Sorry.
Yeah, we
Well-
covered that before. We covered that.
I think the biggest thing about the mask is it's not so much that it will keep you from getting the virus, but what it does primarily more than anything else, it does help to stop the virus from spreading.
Yes.
So those
Yes.
those droplets, or those micro droplets that you do have come out in your mouth and throughout your nose, but while you're talking, breathing even. I've heard of a case where a whole choir got sick, and they were singing together, and everyone got sick because they were just singing. But,
Right. No, but here's the thing. Go.
I was going to say it just stops. That's more so than anything else. It helps to stop It helps to stop you from transmitting it more, instead of letting it just fly out all over the place. It cuts
Right.
that down.
Well, see, here's the thing, because it's also a combination of that and autoimmune device. Like I want to say 15, possibly even 20 years ago, right? They did a study. One of the I can't remember. It's like I said, it's been probably 2 decades ago, where they did this study that I was reading in the newspaper about the study, and then I actually got the study, where they were testing for flu. Right? They're testing the communicable capacity of the influenza, right? And one of the things that how they had this happening is they had like 5 people playing poker together. One of them was infected with the flu, right? This is all right, voluntary. This is nothing, you know. This is they didn't do it unbeknowingly or anything, and so they concluded that that there were things that you could do to stop or prevent it, by lack of context, by lack of letting it get to other mucosal membranes, which is how these things transmit through when they're airborne and so forth. And so in this study, effectively, only the person who was there did not infect the others appreciably with the influenza virus, meaning that if they were infected with it, they had an autoimmune response that was up to the task of staving it off. Now, their joke on that was effectively meaning that, oh, we've just found a we've just found a new cure or preventative for the flu, and it's poker, right? Because the conclusion could be made that, okay, well, given the conditions, poker can stave off influenza. That was the little joke in there. But in that, because they had a closed environment with an infected person who was symptomatic, but he was not transmitting it to the others, right? In poker, you're passing cards around, right? Right. These weren't new decks every time. You know, there was a whole bunch of things, coughing in the area in an enclosed space, but that there were means and methodologies. Now, if we apply some of the same types of understandings that we've had with other airborne illnesses, be they viral strains or bacterial strains, then again, you're right, it's preventative, but a lot of what we're seeing out here are not necessarily right. These designer these designer masks and these obviously homemade masks, and again, that's sometimes part of that theater. It's effectively, like I said before, like those people who buy 6,000. Like, hold on one second. Like
we covered this. We've covered this. You're going over a lot of stuff. We covered this in detail.
Okay. Well, I apologize, son.
No.
It's fine. It's fine.
No. We did cover this. I mean, Dr. Phoenix also, we talked. All of us, we talked about the masks, and we talked about the bandanas and all that. But yeah, we went into that pretty heavily, and
unfortunately, the misinformation is still out there.
People are walking around with no mask on. There's some people who are saying that this is a hoax to this day.
Like you guys said, with cuts in the mask, with holes in the mask.
How do you answer? How does one answer for people still saying it's a hoax? How is that? Explain that to me. Explain that with me.
Because people.
Sentinel, he has his hand raised and waiting for a while.
Okay, go. I'm sorry. I monopolized a lot of time. I apologize.
No, that's right. That's all right. Go ahead, Onyx.
Yeah, I work at a transportation hub, and certain locations that people arrive from, typically the South. Most of the people, I would say, get off with masks on, but normally, between the ages of like 20 to maybe 40, Europeans will be the ones coming off with no masks. That's my personal experience working at a transportation hub, and it's a pretty big one in the metro area. So
yeah,
I just wanted to say that.
Yeah, like Judge Zilla's pointing out, he's actually making a very good point. These sort of improvised masks versus the actual manufactured masks for specific N94 and N95. You see a difference in socioeconomics. The lower the socioeconomic scale you go down, the more likely people are going to improvise, man. Like I said, guys running around looking like Yosemite Sam, bandanas on their face.
we were laughing at that. And that doesn't work. We know that doesn't work. These masks are designed to have a mesh on them that have it's the spaces or the pores that are in that mask are small enough to where they can filter out a disease that's of a certain micron size. That's why some of these masks that are very effective, they're almost hard to breathe in, because it's not going to let a lot of air in that easily, because it's definitely going to filter out, because this virus is of a certain size, a certain size. So if you have mesh that is smaller than the various virus of virion, pieces of the virus that might get in, then you're going to have much greater protection. These people who are making homemade masks don't have any idea of what the micron size of this of this organism might be, or this virus might be. They don't have any idea. They're just putting some across their face, just like a bandana.
I think the idea is to just, when you're talking, I know you're not reducing all the virus particles from coming out your mouth, but you're reducing some. And I guess a smaller viral load is better than just, somebody barefacing it out here.
100%. 100%.
That's
But the point I was trying to illustrate was more this. Okay, so you see a hazmat suit, right? Everybody's familiar with the hazmat suits from like the movies and so forth, right? Those are to keep the pathogens away from the person inside of the suit.
right.
Okay, so what I'm illustrating is this: with these masks, it's the opposite.
Right.
It's more of the opposite. It's to keep your pathogens from getting to other people, or to get them to other people in a smaller amount. Does that make sense?
Yeah. We were saying, and that's what you hear from the CDC and these other ones are saying that, the name of the game is try not to spread the virus, and the masks help to do that. They help you from if you cough, which is a smaller type of activity, but where you're pushing out a certain amount of spray, or however you'd want to say it, putting out a lot.
Exactly. Right. Every time you speak, you expectorate a little bit. Yeah.
Exactly. But if you sneeze, that's even going to go further. So
right.
So that's why having a mask on and this kind of stuff could really help to keep the transmission down by you being able to do that inside of your mask, as opposed to just doing that out in the open. It doesn't get out there. As much of it doesn't get out there. So it keeps the the availability of transmission down. And this has been a pretty aggressive a virus. So since it's aggressive and it catches very quickly, you want to stop its modes of transmission as best as you can. And what you're saying as far as the homemade stuff is not even designed nowhere near to stop something like this.
Right. But again, it will prevent things by restricting that aspiration process.
Yes.
So if you have it, then it'll allow less of it to come out of your lungs, out of your mouth, out of your nose to other people.
Yeah. I mean, you can't use the same bandana that you were using to be, Tupac, so poor, and then use it to, to try to fight the virus, man.
On that point again, and they must be laundered.
Yeah.
There's a shelf life for your available use of these things without them being laundered or disinfected.
It's funny. I got a friend who's a nurse, and she was saying, even your mask that you have, if you have your mask and you can't really wash it, you could put it in the microwave for about 10 seconds, so at least you don't burn up your mask. But some of that, which should kill some of the virus that's on your mask. I was like, put your mask in a microwave? I never heard that before.
Boiling water. Like,
maybe that makes sense.
Put 20 ounces of water in a microwave for a 1,000-watt microwave for roughly 4 minutes. 4 minutes to get it to boiling, and put your mask inside of that and let it sit inside that to boil and sterilize it. Or wet it completely and put it in the mic so that you're sterilizing it. You're killing bacteria and mold bacteria and viral and viruses by steam heat, right? But you can't use the same mask for a week without laundering it. You really shouldn't be using it for more than 4 hours without it being laundered.
Yeah. I mean, and that's, and there's information out on that, but a lot of people are not following up on this stuff. You got people not even wearing masks. I mean, my friend, he's out there in Arizona, and people walk around there, no masks on, working in stores and stuff, and, running around. So now they're making it mandatory. You have to have a mask on now. But before, and this is just recently. So how much more stuff has been passed around in these states that are not, exceedingly fastidious about this? So I don't. And it's kind of crazy.
Let me get you the next item on the docket. This is from the WashingtonPost.com. Children are only half as likely to get infected with coronavirus, study finds. Children and teenagers are only half as likely to get infected with the coronavirus as adults aged 20 and older, and they usually don't develop clinical symptoms of COVID-19, the disease caused by the virus, according to a study published Tuesday. The findings could influence policymakers who are facing tough decisions about when and how to reopen schools and daycare centers. Distance learning has been challenging for teachers, students, and parents, and there is pressure on officials to restart in-person schooling and daycare to free up parents who have been juggling work and childcare. These results have implications for the likely effectiveness of school closures in mitigating SARS-CoV-2 transmission, in that these might be less effective than the other respiratory infections, right? The authors, based at the London School of Hygiene and Tropical Medicine. The study also has implications for the likely disease burden in countries with much younger populations, many of which are in the developing world. Most of the countries hit hardest by coronavirus have had relatively old populations. From the start of the pandemic, it has been known that children are typically spared the worst effects of the disease. They rarely die of it, but they can still get sick and can spread the virus, including to older family members who are more likely to have a severe illness. So I'm not going to go too much into this, but we had known this before, that kids were least likely to be impacted by it in terms of the death toll. I mean, they're finding out that dogs are starting to carry the transmission as well. So if you have a pet, you know, it's likely that the pet has been infected as well.
Yeah, my friend thinks that he felt his family had it. He felt his dog got it. His dog one day got really sick and was out for like 3 days. He thought the dog was going to die, but the dog recovered. So
it's really transmissible through cats as well.
Yeah, you can get.
The reason why they found out through that tiger, and then also house cats.
Yeah, tigers it was at the Bronx Zoo. 3 of them got it.
Yeah, house cats and they go outside. Yeah, I would be mindful of that.
Isn't this a universal trait of coronavirus families? Is other coronavirus families? Because I believe this was the same issue with ours and MERS as well, wasn't it?
I believe that may be true, but I'm not to say exactly sure. I think that sounds right, because I think I did hear that, but I'm not exactly sure. Dr. Phoenix, if he was here, he would probably know a lot.
Yeah. He's probably obviously very busy right now.
He's in school, man. He's in school.
Yeah. Let me jump to the next item on the docket from MiamiHerald.com. Florida's number of confirmed new COVID-19 cases exceeds 2,000 for a second day in a row. They were the first ones to reopen.
Yeah, it's that beach, man. Those beaches, and that's what's happening in Brazil. Those beaches, I don't think it's very smart.
Sunday, Florida halted its 3-day run of single day highs for positive COVID-19 cases reported, and the day's positive test rate slid down toward the overall positive test rate. Still, the 2016 confirmed new novel coronavirus cases in. I'm just raising him. New novel coronavirus cases in Sunday's update represented the second largest single day total for the state. South Florida accounted for 740 of the new cases, 36.7%, but 4 of the 6 new deaths. The percentage of people who tested positive for the first time was 4.46% in Sunday's update, the lowest in 4 days, and the day after a June high of 6.21%. Florida has had 75,568 COVID-19 cases with 2,931 deaths and an overall positive test rate of 5.4%. Another 64 cases in Broward County brought its overall number to 8,928 with an overall positive test rate of 6.3%. After the daily rates were in the 5% and 6% range all week, Saturday dropped to 2.7% according to the state's report. There were no deaths, leaving that number at 357. Yeah, I find this to be very interesting. People weren't wearing. I saw this early in the day, but people weren't wearing masks.
He's not wearing a mask and addressing it. Like, it's okay. I think that there's a weird thing here. Okay, initially when it happened, it seemed like people were treating it like it was a blizzard, like it was going to blow over, right? And that's why I kept trying to tell people, I'm like, no, this is life now. It's measles, mumps, rubella, and COVID now. This is life now. And now it seems to be that people are thinking this way. It seems to be that they're thinking, oh, well, if we go out and intermingle, then the people who are susceptible to it are going to get sick and die, but everybody else is just going to get medium to mild symptoms. And then I think they think it's a one and done. And just like the influenza, it's not a one and done. This is life now. Everybody is susceptible to it. Everybody's just not all susceptible to the complications associated with it. You know, this is life now. Measles, mumps, rubella, COVID. You know, meningitis, right? Meningitis. What's the other one that you have to get the booster for when you go into university? I think I think it's meningitis, isn't it?
They have one from meningitis test.
Yeah, you know, this is life now. This exists now.
Mononucleosis.
That another one, right? This is life now. This is what is. Right? It's not a one and done. It's not you get exposed to it now and you're immune to it for the future.
Mm-hmm.
You know, but I think people are having that, right? Because they've gotten past that. They've realized it's not that blizzard situation and it's just going to blow over. But now they think that, okay, well, the people who are going to be hurt worse for it, oh, they're going to die off for it, but everybody else is going to be okay and everything's going to be loud conky-dory. No, you can get this year, you can get this again, and you can get it now, you can get it in 6 months, you can get it in another year, you can get it in 5 years from now. And all of those cases are going to be different for how you're going to experience them.
Well, you know, like I said, you know, we had we've seen these kind of pandemics before. That's why you see Dr. Fauci and all them, you know, they were going ham by talking with people about how these things tend to operate. And we saw how vicious, you know, it was back in 1918. And, you know, and it didn't really go away really till about 21, till about 21 or so. And then after that, you know, we were pretty clean. You know, we had a decent run, but there were other pandemics that came up that weren't as virulent. And here we are, in another one, roughly 100 years later, and here we are. You know,
but we've had these updates, right? People who got bird flu also got SARS, and people who got bird flu and SARS also got COVID.
You know, well, exactly.
You know?
I mean, COVID's been with us forever because COVID is the basic cold.
Well, COVID-19. I mean, but these are all SARS and our coronaviruses. They're just mutations, right? So
they are. So at some point in time, this too will fade. And then there'll be something else that will come up that will be maybe not similar to this, but different and affect you differently, and it will hit, and we won't see it. We would not have seen it before, and it will, you know, it will do damage. The thing that bothers me more than anything else is that we should have been on this thing far earlier than we were, and with prevention and so forth, far earlier, we would have. We wouldn't be kind of in this desperate kind of position and all this crazy thinking we have going on now. Had we taken this thing seriously, when Trump was walking around saying that this thing was a political hoax, had we taken it very seriously then and really started to mask up and arm up, if you will, I don't think we would have seen as many cases.
They're going back then. Black people had a magic gene that made them immune from COVID.
People were talking crazy. People were talking straight craziness. Black people can't get it. Really, insane.
Yeah, let me go to DE Raptor. He has his hand raised. Plus, I think he has some information about Florida.
DE.
Yeah. Shalom, everybody.
What's up, baby? What's up?
Today I just got out of the house and went for a drive down to Fort Pierce. I was looking at a motorcycle and a camera.
Okay.
Everywhere I went down there, I was the only person wearing a mask. I mean, I saw people, when I say wearing a mask, covering my nose and mouth. Other people, I see two or three other people with the mask hanging down around their chin. But what struck me most was one store that I went into, and there were these two people. They were walking around the store, this little Chihuahua, and I saw about 15 or 20 people kiss that Chihuahua.
Unbelievable.
I was laughing to myself. I said, no wonder it looked like everybody in Florida is going to die soon. Because these people down there don't care about what they're doing.
People were kissing the dog, fam?
Yes, bruh. I'm serious. I wish I had taken a photo of it. I should have taken a photo. People walking around, you know. As a matter of fact, the lady was walking around the store. She said, "Oh yeah, I came from Illinois. I came from
You didn't see
Illinois.
that.
I came from Louisiana." I said, imagine this person. Everywhere they go, this little dog is kissing everybody, and this is one of the people who are spreading this thing all over the country.
Nah, I find that hard to believe, man. Nah, that didn't happen.
He's right in the sense that that's
if you think I'm lying to you,
I'm just
fine.
goofing, man.
Come to Florida, bro.
Nah, man, I'm gonna stay out of, I'm staying out of Florida, bro.
This is not the first time that I have seen it in the last couple of months.
Damn. Did you say anything to the lady when you saw her doing it?
Not me.
Not me.
Not me.
Listen, if you took the Vince Lombardi trophy or the Stanley Cup out today on a tour, what would happen?
Hey, look, those are the people who set the police on people. You understand? Yeah. You say something to them, they call the police on you. Next thing you know, I'm out there in front of this store dead.
But isn't it?
And I'd rather have her laid out cold than me. So you know what? Go ahead and let the dog kiss all y'all people. I'm not kidding.
Yeah, but
go ahead and kiss all. Go ahead and kiss.
Yeah, but the thing is, they want to contact trace everybody. Have you been to China? Have you traveled anywhere? I mean, that dog. I mean, who's questioning the dog? What's the contact tracing on the dog?
I don't know. I think contact tracing should be, have you been to Florida? Have you been to that store where they had the dog? Have you been over there? That's what they should be doing.
I mean, but what DE Raptor's pointing out about people with their masks sagging, not only did they sag their pants, they sag their mask. This is culture, man. This is culture. I'm cool.
I go to restaurants and I see people behind that serving people. No mask.
No mask.
I'm sorry, you guys know me, man, but it's only a matter of time before people are going to be wearing their masks on backwards.
They're already doing that.
Behind the head.
Breathing through the back
of
your
head, bro. Like people wear caps with the peak behind the head. That's the weird. Some of them wear black people. I'm serious.
Wearing their masks like a yarmulke with a strap.
Yeah, there was somebody. You asshole. There's somebody in the manosphere. I'm not going to mention their name. The other day they had, this big ass 5950 New Era fitted hat over their head and had their mask on backwards, man, looking crazy. So I know what he's saying to be true. So
yeah, that's crazy. That's a fashion statement now. These folks are just insane, man. Insane in the memory.
Let me get to this next item.
I'm kidding. Shoot.
Let me get to this next item on the docket. This is from Reuters. Record spikes in new coronavirus cases. Hospitalizations swept parts of the U.S. New coronavirus cases and hospitalizations and record numbers swept through more U.S. states, including Florida and Texas, as most push ahead with reopening. And President Donald Trump plans an indoor rally in Tulsa, Oklahoma this Saturday. Alabama reported a record number of new cases for the fourth day in a row on Sunday. Alaska, Arizona, Arkansas, California, Florida, North Carolina, Oklahoma, and South Carolina all had record numbers of new cases in the past 3 days, according to a Reuters tally. Many state health officials partly attribute the increase to gatherings over the Memorial Day holiday weekend in late May. In Louisiana, which had been one of the earlier virus hotspots, new cases were again on the rise with over 1,200, the most there since May 21st. Nationally, there were over 25,000 new cases reported on Saturday, the highest tally for a Saturday since May 2nd, in part due to a significant increase of testing over the past 6 weeks. So there's a lot of people walking around who have not been tested that's carrying it. Perhaps more troubling for health officials, many of these states are also seeing record hospitalizations, a metric not affected by increased testing. Arkansas, North Carolina, Texas, and Utah all had record number of patients enter the hospital on Saturday. In South Carolina, 69 to 77% of hospital beds are occupied depending on the region. While Utah's governor announced last week that most counties there would pause their reopenings, most states are not considering a second shutdown as they face budget shortfalls and double-digit unemployment. Many went ahead with reopenings before meeting a government infection rate guidelines for doing so. New York, the hardest hit state, has utilized health guidelines to instruct its reopening and continues to see all measures of infection drop. New cases, deaths, hospitalizations, and positive rates among those getting tested. However, Governor Andrew Cuomo warned New York City and Long Island officials on Sunday that their reopenings were at risk if they do not stop further large public gatherings that he said are threatening progress on curbing the spread of the virus. So, you go ahead and you want to go to the movies. I saw AMC has opened up their theaters in a couple of places. Good luck, man. Good luck. You want to see a movie that bad? You want to sit up in a place with unknown people, man? I'm all set.
I'll tell you this. Disneyland is open and it's at 20 to 25% of capacity. Mm-hmm. So it's never been a more and less opportune time to go to Disneyland or Disney World.
I knew they were going to open it up when I saw the Disney stock go down. Looked at their earnings, were looking real bad. It's a big part of it. Big part of their money is tied up in those parks. So they were going to try to get those parks open, man. They're going to try to get them open.
As regards to the article, does anybody have a problem with the language that they're using rather than showing the actual figures?
Yeah, they don't want to show the figures, man.
Because it's easy to say new records, right? But that just like the only thing that qualifies for a new record high is one more than the last record high. So, and that's the thing is charting trends is a whole lot, right? Just the physical numerical value doesn't give us a lot of information without being able to chart trend lines, right? Am I making sense? Or am I a little bit out there on this one?
I think there's some feedback. Somebody on the panel has some feedback. No, you're making sense, Judge. You're making sense. But it makes for good content on their behalf. Let's go to Perfect Blackness. Perfect Blackness. Okay, I think he stepped away. All right, next item on the docket is from fastcompany.com. There's a key way to curb the spread of COVID-19, but no one is talking about it. With protests in full swing in many parts of the country open again, it's easy to forget that COVID-19 is still lurking and anticipated to take an additional 100,000 American lives by October. Scientists now concur that COVID-19 spreads primarily in droplets through the air, be it from coughing or just talking. So public health officials recommend that people wear masks and face shields and maintain social distancing of at least 6 feet. But many researchers believe that these guidelines don't go far enough to truly help protect people from transmitting COVID-19. We need to fix the air we breathe. Over the past months, Fast Company has connected with many experts on the topic of air quality and circulation. They've offered a variety of best practices for everyone from restaurant owners to CEOs to families to consider. Here's what we've learned so far. Social distancing isn't nearly necessarily enough. We've heard it again and again that 6 feet of social distance creates a safe buffer, and restaurants, offices, and even Starbucks cafes are being redesigned around that tenet. Social distance does help prevent transmission, but according to new modeling, even a small breeze can spread COVID-19 up to 20 feet.
I heard up to 32 feet if you sneeze and this kind of stuff. I'm hearing all kinds of stuff.
Well, the models right here that they're showing.
Look, but again, we know this, right? We know this from at least 20 years, right? Why have they told you for 20 years not to keep your toothbrush in the bathroom?
Yeah.
Right? We all know this, right? There's a perfect reason for not keeping your your toothbrush in the bathroom.
Yeah.
Because every time you flush the toilet, you aspirate E. coli.
Yeah. But people are not really thinking about that with respect to stopping disease. That is
But-
just that is
But we've
just,
known that when you sneeze, right, it comes out at approximately 60 miles per. Like again, we've known this.
it's
So let me finish the article.
Anyway,
Demetrius Drikakis, the professor at University of Nicosia, Cyprus, who created the model, insists that the findings doesn't mean that someone coughing 20 feet away will get you instantly sick. The overall amount of virus you breathe in over time matters too. But his research does confirm that even outdoors, distance gathering comes with some risk. And given these findings, we should scrutinize our indoor air aggressively too. Something experts in air quality talk about a lot is how many liters of air a person is getting per minute, whether that's inside a cruise ship or a building. A portion of that air might be fresh air pumped in from outside, and a portion will be recirculated. According to Qingyang Chen, professor of mechanical engineering at Purdue University, planes are pretty good about providing clean air to passengers because floor vents suck away air from passengers in through HEPA filters you don't see before pumping it back through the cabin. This system is by no means perfect, but HEPA filters capture 99% or more of viruses that are 0.3 microns or larger. On cruise ships and in many buildings, HVAC systems use lower quality air filters, which might catch just 20 to 40% of viruses passing through. On the tragic Diamond Princess cruise ship, which quarantined thousands of passengers to their rooms for nearly a month, while the ship was dry docked in Tokyo Bay, air circulated between cabins without HEPA filtering, infecting 700 people and killing 8 people who were breathing the same old stew of air. In our reporting from architects and office specialists, we've heard that U.S. office buildings may begin to retrofit with higher end HVAC systems, with HEPA filters and even UV light sterilization hiding in the ducts, which are more common in China, but it's hard to quantify how many companies and landlords are actually taking those steps. The safest option for quarantining viruses in the air are negative pressure rooms, which operate like vacuum cleaners, ensuring that no pathogens can escape. But they are designed for hospitals. They are not feasible for hotels, offices, and other buildings for a variety of reasons, including expense, the difficulty in validating their design, and the fact that every office worker in America would need their own office with a door that is always closed. Only 2 to 4% of all hospital rooms are equipped to be negative pressure spaces as it is. So I'm not going to read this whole thing because it's actually something that we had talked about before, redesigning facilities. Let me advance these people. Advancing these facilities that we go to. I mean, most work environments, if your building was built in the last 10 to 15 years, it probably already has these sort of designs in place. But do you really want to be in a facility anyways, man, where this is even necessary? I don't know, man. I just don't want to be around these people. Let's go to Perfect Blackness.
Hey, what's up, John? Can you hear me?
Yeah, we can hear you now.
Hey, I got a question, and this is something I've been kind of milling over because I'm kind of torn between all of this. I know, I'm real diligent about wearing my mask and everything, and my wife, I spent a good penny on some good washable masks with some independent filters and all that type of stuff. But and I'm actually, and I'm kind of on this whole thing. This actually these masks being actually a new norm. You know what I mean? So, but how long do you think that the economy should be, I don't know, shut down in this fashion? I mean, how long should it be? Because
until they test everybody.
okay, well,
And
how?
get 90% testing. You're not going to get the homeless people. They're wayward, right? That's your, that's your give or take.
But how do you achieve that? Now, I don't disagree with that. I think it should, but how do you achieve that? How do you really do that in a nation of 350 million people? How do you do that?
It would have to be a highly organized, setup. We've seen it in China. We've seen it in Korea, South
Well,
Korea.
China, they
You know,
they have a dictatorship. They could do that easily. I mean, how do
hold
you
on,
do that?
hold on a second. We've seen it in China. We've seen it in South Korea, which is not a totalitarian state, more or less. We've seen it in Germany, which is not a totalitarian state. We've seen it, these are some of the major countries that have had excellent responses.
Mm-hmm.
And what we've seen is that they've had a very well organized situation where they were able to set up in each area or each city, or they had various setups where people would go from you kind of had to do it. It was almost like mandatory. You had to go and get tested. The government was covering it, so you didn't. So it wasn't like you had to spend a whole lot of your own money to do this. The government had sponsored various testing centers where you were kind of were required to go, and people would go wait in line and go and get tested, and they would see what was going on, and then people started to get an idea as to what was going on. They were getting a handle as to who was sick and who wasn't. They started testing. So what happened was you had to initiate testing, and we certainly could have enough centers set up here in the United States in which to do this. But the way our medical system is set up and the whole game, it's the reason why it seems crazy to you, because you're in a chaotic system that doesn't make sense to you to be able to sit there and say, well, how could we do this? This is done very easily, but we haven't done it because our system we have not set ourselves up to do this. Testing centers were all throughout Germany. So you could go anywhere in Stuttgart, Berlin, wherever you were, even to some of your more rural areas, they had testing centers where you had to walk in and get tested. And people you contacted either by phone, through their TV and internet about, where the centers were, setting up appointments to go and get tested. It was a very simple thing. And people answered the call. You have people, in India, they were knocking on people's doors and giving them certain kind of preventatives as well. So, I mean, you have, it's an organized setup. It's an organized response. It seems crazy to you here because you're in a chaotic, crazy system, which ultimately makes it look like this can't be done. But it's not very easily. This can be done very easily. And we didn't take advantage of the time that we had. We're going back now. We've been here since March, June, 3 months, March, okay, May, March, April, May, June. We've had over 90 days. No major testing has gone on. No major testing centers have been opened up. You have a lot of, the dollars and cents is about what this thing is about more so than anything else. Whereas these other countries, they have a subsidized game to where a nationalized medical system, where it was easier to do this. So our system is not really geared to handle this kind of situation the way it should be. And, we could have set it up this way, but, we just lack of leadership and so forth we had which was just terrible. So we did not organize this thing in a way that it needed to be done to do this thing right. Not enough testing are even available. Crazy. Anyway, go ahead.
Now, see, that's kind of where I was going. Because again, I agree. I mean, I think mandatory testing should be going. I think we should do all of that. But in this nation, in the United States of America, with capitalism and you have such for lack of a better word, a stiff-necked populace.
Well, the population would do it, but You know,
A nation
we
with
weren't.
this culture, how do you do it?
We very simple. If we said, listen, you have to get the governor. If governor of every state said, listen, you have to do this, you have to show up at XYZ, you have to be XYZ where, and then we're going to have these centers set up at XYZ areas, and you have to go there and get tested over the next couple of weeks. And they were making this thing mandatory for us to do. Well, I don't have to get tested.
But how realistic, I don't mean to interrupt, but how realistic is that for all 50 states to do it, especially when you're talking about some of these I don't want to be racist. Some of these states who detest anything that's coming down from the federal government. How do you do that when if they're gonna say, well, states' rights, they're gonna do it. I'm telling you, they're not gonna do it. So how do you do this?
Well, let me say this. You certainly had a lot of people say they detest anything from the federal government, but my God, they certainly took them checks, though, didn't they?
So at the end of the
that's a different thing.
Only thing I'm saying is, at the end of the day, had you set this thing up for people to go, they would go. All right, that was the.
I agree. I agree.
You never saw that. You never saw that. Just like I said, that's how you do it. This is how you do it. It's very simple. That's how you do it.
Let me go to Judge Zilla.
No, piggybacking on what Nagone said right there, and I'm so happy that you said it because not enough people do say it. Like I said, I'm neither red nor blue, but everybody's putting it on the Fed when your first line of defense was your governor, and they had the means to fund these types of things 5 to 7 years ago, and they chose to focus they chose to steer those dollars to crony fucking pockets instead of helping the people. But yeah, as far as the other thing goes, like I said, I'm a broken record, again, broken record in the 1970s, 1980s, 1990s, with the last article, sick building syndrome, right? We understood this. This is not new information. What the hell?
I guess see for me, I'm not arguing the actual the nation's ability to do it. We have more ability, or just at least just as much as ability as any other nation in the world to do it. My question is this nation's will to do it. Okay, because there again, I say a stiff-necked populace where you got stiff-necked politicians who see everything in political and geopolitical circumstance where, well, this is just, you're trampling on free market capitalism. Let's let capitalism fix everything, and they're not going to do it. Even if they're ordered to do it, it'll be tied up in courts. It'll be all in appeals, and with this conservative court, don't look for this conservative Supreme Court to force the states to do anything. Unless people are actually dying in the streets. That's what it would take.
Well, because it takes 30 days to really start showing these sort of symptoms, right? A person will be carried and won't even know it. But you open up the economy to all of this, just to save the businesses at the expense of the citizens of the United States. You won't have a country very soon. I mean, they're talking. The last article, they're talking 180,000 by October dead. If you keep going at this rate, I don't know. It doesn't seem logical. I mean, those are.
I agree, but you also got people in the government who are denying that there can be a second wave. Well, again, what I'm saying is that you got too many powerful people who are going to argue for how long can you keep the economy down? I agree. Please don't get me wrong. I agree with you. I definitely agree, but how long can we realistically expect the economy to be held down, and that governors and the populace will go along with it?
Opening it up doesn't help. It actually hurts the economy even more.
I'm not arguing that. I'm not.
The whole thing, family, is what I want to say was the big mess up from this whole thing, and the big the fiasco behind this was the fact that we did not have an early response, that we did not get on this early. That's why we're in the position we are in. We haven't got any testing since. We're trying to open up the economy with no testing.
I would argue that the reason why was for some of the reasons why I'm stating right now.
No. You had your president out there saying, we said this earlier before you came on. President was out here saying, no, this thing is a hoax. The Democrats are calling this thing. This is in February.
Exactly.
Now.
There you go.
This thing is a hoax. The president. It's a Democratic ploy, to do whatever. And he waited almost 3 weeks later to start to move on this thing. And that's why you had all this madness that happened. And then, during the period that we were shut down, we squandered it because we didn't have any real serious testing going on. In enough areas. Some areas actually tested fairly well. Some people did it in certain states. They actually had that where a lot of people went and got tested. But in Seattle, Washington, and Washington State, I know that I think somebody in the chat was like, well, he's in Washington State, and people were protesting. They may have been protesting mandatory testing, but a lot of people in Washington, in Seattle and so forth, a lot of people got tested. A lot of people got tested in a few other states. I'm forgetting what states they were, but some states did very well. Others have done very poorly. In New York State, it's been bad news, and the governor and all of them have been going crazy behind what's been happening. But you didn't have enough testing centers around, and people just weren't getting tested because you didn't have enough centers. Some people had to go, a long way. We should have had a lot more centers, a lot more testing sites. We just were not. We just did not have a good response to this, and forget about just the president, but then from the CDC on down, we just didn't have a lot of good follow up. It was very bad.
They can spend $50,000 locking up non-violent offenders. Okay, $50,000, but they could not afford test kits.
Couldn't afford
test kits, but can afford to lock up Black men for non-violent offenses.
For non-violent offenses, they're getting pissed at you, standing on your neck, got you spitting blood out here, shooting you up, and all kind of craziness. I mean, well, give the police more money, but yet people haven't been tested. I mean, this country is fucked up. This place is psychotic. This is psychotic.
That's what I'm in agreement with, and that's why I'm glad that you brought up again the governors. You both have brought up the governors, right? Because they tend to they tend to be able to hide in the shadows a lot of the damn time. The governors and your local council members, they get to hide by throwing the blame at the bigger position. Not to say that the bigger position the federal government isn't blameless, but your immediate safety is more relegated to your immediate leadership. And so because they had that's the whole thing. They had the ability to funnel these dollars in to protecting their constituents. Mm-hmm. They chose to funnel these dollars into places that would support their power and would richen the pockets of their buddies. That's what they chose to do with it. They chose to do nonsense. They chose to put these dollars towards nonsensical projects that didn't actually benefit the actual populace by putting up stupid fountains and making silly memorial parks.
But not only that, they defunded. A lot of states defunded the healthcare bills and so forth in their states.
Yes,
a lot of them.
Yes. I was going to go to that one there.
Yes,
that was one that I was going to go to, and again, I'm a registered independent. I'm neither blue nor red, but a lot of this stuff, the defunding, a lot of medical defunding, all this stuff started up under Reaganomics. They start pulling away from all of that. Now, I agree that there should be testing centers in every goddamn city. Now, but who among us believe that state governors are going to want to pay for that? Who among us believe that there are federal that are in the Congress, in the U.S. Congress and the Senate will actually sign off on that?
Well. See, some states can do it, but some states are going to have to get funded by the Fed. and the feds will have to come up with
No,
some.
I think every state can do it. Every state can do it.
I know some states are fucked up, man. But I'll say New York.
Well, I'll probably say maybe one state that probably can't, and then maybe that's Kansas. Every other state can actually.
I mean, you start going into the South, man. In some respects, you're dealing with quasi third world countries inside of the United States.
Yeah, you're right on that, but that's by choice. That's by
well,
no.
It's certainly not by choice.
Doing that.
It's because they don't have.
They don't have the actual money on hand.
They don't have the production, the industrial infrastructure and so forth to really handle a lot of that. A lot of them just haven't. The states that do are the wealthy ones. They tend to be the blue states. But anyway.
Yeah, I want to go to DE Raptor because he's been waiting for about.
Go ahead, DE man, jump in there.
Well, this argument's getting down to red states and blue states, but what you have in America is really an ignorant population. A population who, can look at a president and can't see that he's not doing a good job. And they will follow him rather than read for themselves. He will say, don't put a mask on, and people will get out there and say, we're not going to put mask on. We're going to go protest for our right not to wear masks. We want to go back to work without considering the consequences. And this has been the case throughout American history. And we are seeing it in a massive way. It's failing now. People are just, well, I'm not saying we, because a lot of people are still not looking at it. Like I said today, I go out and I'm the only one wearing a mask. So you got 15 million people in Florida, maybe 100,000 wearing a mask. And we are watching as people come out of their houses, that the number of people getting sick with this thing, or showing up sick, I should say, increasing. And nobody seems to be caring. If people will look at the numbers yesterday and say, hey, I should see everybody out in a mask today. I shouldn't see anybody at the beach with their kids. When I go to the stores, no kids should be in there. No, like people kissing dogs and all that kind of stuff. These are ignorant people. People who
Crazy.
have no kind of, and these are people who can tell you that they hate black people. And anytime that the president come out, or not even president, their congressman come out and say, the fault of all our problems is black people. We got to put them in jail. Yep, I agree. Put them in jail.
I have no problem.
Don't get the police to shoot them. And they follow this crowd.
Yeah, I need to get
regardless of what the consequences are without even thinking about it.
Yeah, I need to get to the next item on the docket. This is from the Times of Israel. Dominant form of virus 10 times more infectious than original strain. Researchers say mutation in Wuhan virus gave it sturdier spikes to latch on cells, with lab tests showing it's far more contagious, but some scientists urge caution. A form of the novel coronavirus, which has become the dominant type in much of the world, may have done so thanks to a mutation that allows it to better latch onto humans' host cells, new research indicates. Lab tests performed by US-based Scripps Research in a study which has not yet been peer-reviewed show that this isolate of the SARS-CoV-2 virus, which was much more infectious than others when introduced to cell structures. Researchers said the spike D614G mutation, which has proliferated around the world, has sturdier spikes. The projections on the virus's body through which it attaches to cells and which give the virus its crown or corona than the original Wuhan strain. So I'm not going to go into all this because I don't have a whole lot of time, but this shit is ill. This is we're in the second wave right now, and you got people out there fighting to open up businesses for what?
This, I'm telling you, and with this, and that it's following very closely to the. What people need to do is just simply go and study the 1918 virus, and they have some very good videos here on YouTube, which actually kind of go into this virus and show how you know how it operated and how it infected people and how it hit its first wave, how it hit its second wave, how it hit its third wave, and the results of that. And this is looking very similar. I think these things move very similarly, maybe not exactly the same, but they do move in a very similar type of fashion. And now if we're seeing a more virulent second strain, another strain, and there are a lot of strains out there, but the ones that will tend to survive are the ones that are a little stronger and can will withstand defenses, and then get out there and then proliferate and do work. And that's what looks like this is happening. And this is very, very, very similar to what happened in 1918. So if there's a second wave coming, I think it's going to be a tough one, and we're not prepared. We're not prepared. We were in a dream world. It happened the same way the first time. People were going out having parades and stuff, doing the same shit, and then second wave hit, and it was severe. And I would hope that we could avoid that, but it looks like that maybe this will not happen. Maybe this virus may not be as bad as one in 1918, but if it is bad in any way, we're gonna have some problems. We're looking at some real serious problems coming in October and rolling into November, which I think is going to be fairly serious business.
Hey, Nagone, how many broadcasts do you see is CNN or Fox News discussing this article?
Discussing this article?
Yeah.
I can tell you what I've seen so far, freaking zero.
So where the people who get their advice from these people, and their advice is very straightforward, when they come out and say, you know what, I hate Black Lives Matter. I hate Black people, but they can't come out and see and take a look at something like this. They'd rather be boiled up, rather than protect themselves.
Yeah.
Well, this is another media. So also remember this whole black thing and what's going on. This is almost a respite from the COVID news and so forth. So they're trying to run a whole other news cycle, and they're running a whole another news cycle. This is what's going on here. We're not keeping our eye on this. Which these not to say these other situations that are going on are not important, but this COVID is very important as well, and we definitely should have these kind of articles. We definitely should have these type of articles all over the news, but they don't seem to be making the mainstream media. Takes guys like Mike and them to find these articles and be literally the griot out here.
Well, they complain about us in the manosphere. They complain about the black interest in the manosphere. Mm-hmm. Where else in the manosphere you find this stuff? The Negro manosphere, as they call it. Where?
I take a more cynical view of all of this.
Okay.
When I see articles like this, I come to it just buttress my conclusions that I feel that it's going to have more deaths from the coronavirus is needed, and I hate to say that because look at the article, look at that. And these are the power brokers of this whole entire nation. This is what they say.
Yeah.
So from the way I see it, yeah, it's going to more deaths are needed. More is needed because you got too many people who ascribe to this not because of what they know. You got some of
I think we lost his brother. Let me go to WashingtonPost.com. Live updates. Pence calls concerns about coronavirus spike overblown as cases.
Oh shit! Oh shit! Damn! Shit! Holy crap!
You see what's happening now? His boss, the president, used to be the one who used to come out and say these things. Guess what? Nobody's believing the boss now, so guess who they're getting to do it?
Well, Pence hasn't spoken a lot, man. He kind of just walks
around. That's what I mean. He never he was in the background except for that one thing with the mask. When people jumped on him, he's staying quiet. His boss is the one who's doing all the fuss and fighting. But guess what? Now he's come out.
With this statement, he should stay silent, man. This guy, this guy, man. I swear. Wow. Anyway, Mike, go ahead, man. Continue with this madness. Go ahead.
No, I don't need to read any more of it. I mean, the guy said it's overblown. We got cases from Florida, you know, all the red states, you know, still seeing spikes.
Kissing dogs.
Well, this guy says that it's overblown. That's cases surge in a dozen states. I mean, that's the sort of leadership that's in this country. You go into November with something like this, you're finished.
That's all right. And
I'm telling you, only thing they need to do is just play just some of these videos of the president and then get this knucklehead now. But the president, oh, this is a hoax, and oh, this is just get him to. He's done so much to damage himself. I mean, this is incredible. Some of the stuff these guys are saying. I mean, they denied all of this. Now, all these people who have died, you know, well, 35,000 people a year die, so that's this is no surprise. This is just something that happened. This is a hoax. Now we're over 100,000 deaths, and what's this guy got to say now? I mean, it's just wow, man. The leadership.
You know, I honestly think that I think we are underestimating the wishes of the people. Look at here. That man is in office. Trust me when I tell you, he is leading in the polls say one thing. That man is actually, I think he's leading far more than what people think. Biden said he is intent on getting a black woman vice president and Supreme Court justice. Do you honestly think they're going to look at him and they're going to look at the Trumpster? And do you honestly believe that they're going to put someone else in office just based upon the best candidate or the most logical person? Hell no. They're going to go with the orange orangutan because he appeals to their needs or their perceived needs. And
well, the numbers have always tended to over the last 100 years.
Dogs in the mouth. I have no problem with people kissing their own people in the mouth. I have no problem with that.
Kiss the dog. But anyway, the last 100 years, the numbers have greatly favored the incumbent. I mean, that has actually been the case over history.
Yeah, that's true. That is true.
But over the last 100 years, I think we had 20 presidents overall elected. And out of that, 15 have been reelected hands down. Now, you know, just reelected. And then we had 4 who were not. And then we had 1 who, you know, was appointed after Nixon and Agnew and them, you know, all got, you know, had to leave office for different reasons. But yeah, that's how that's been. So it's been over an 80% rate if you really want to, you know, look at it. So at least 80%. So the numbers favor him. I mean, at the end of the day, the odds do favor the incumbent. That's how this thing is set up. It does favor the incumbent. So the incumbent has a great chance of winning. So to think that he doesn't have a great chance of winning, it would be foolish. But you know, he is vulnerable. He can be beaten if one is able to move to get the you know, the game moving properly. But we'll see if these Dems are able to do it. I have my doubts as well. But
I have my doubts because in times of crisis, people always stick with the incumbent.
They tend to stick with the devil they know as opposed to devil.
Stick with the devil that they know rather than going with the devil that they don't know, especially one that's coming in and saying, I'm going to hire some black woman as the vice president. That right there, that's a non-starter.
Let me get to the next item on the docket. This is from the Washington Post again. Coronavirus recommendations ignored as case numbers rise. You see these people sitting in a picture. They want to have a drink, man. And this guy, you know, these guys don't have any mask on. These people don't have any mask on. This guy has a, bandana around his face looking crazy. This person over here doesn't have a mask on. This is how Mazungas are running, man. This is it, man. Just so they can put a straw in their mouth and sip, man. And
oh, boy.
Just so they can taste freedom.
That's Mazungas.
Yeah, that's how Mazungas roll.
They're finished. They're highly finished. They're running around crazy out here. It's madness.
let me just read
Madness.
Let me just read this blurb real quick. Coronavirus infections continue to rise in many parts of the divided nation on Monday, with public health recommendations under attack from communities tired of staying home and officials eager to restart local economies. Even as the number of infections rose and hospital beds filled, in some places, voices clamored for an end to mandatory mask wearing and reflexation of restrictions designed to curb the novel coronavirus continue. They are either just over it or they've come to believe it's a phony pandemic because their own personal grandmother hasn't been affected yet, said Andrew Neumer, an epidemiologist at the University of California at Irvine in Orange County. Elected officials last week forced the county health department to scale back a mask wearing order. People just think this is a nothing burger, so they think the risk is over exaggerated. Two associations of local health officials released a statement warning that public health department officials and staff have been physically threatened and politically scapegoated. And the vital work of public health departments is also being challenged. Public health departments are facing lawsuits over their authority to close businesses, schools, and places of worship in order to protect the community at large. The very action that is credited with saving hundreds of thousands of American lives from this virus, the National Association of County and City Health Officials and the Big Cities Health Coalition said. 10 states, Alabama, Arkansas, California, Florida, Nevada, North Carolina, Oklahoma, South Carolina, Tennessee, and Texas hit new highs for hospitalized patients on Sunday, according to data maintained by the Washington Post. So this is what's going on here, okay? Mazunga's getting restless. They won't go out there to a bar and watch what game, I don't know what, there's nothing on TV. Everything is just a rerun, just so they can come outside.
Oh, sorry.
This is what it's coming down to. They want to have, an IPA, okay? They want to have an IPA. Want to sit at some bar outside, and look crazy. It's just this.
Yeah, it's pure madness. It's pure madness. It was funny. My brother and I, we were up by White Plains, this past weekend, and we were just cruising up around, and we saw people walking around and trying to sit outside in some of the outside restaurants that they were slowly opening up, and people dipping around, no masks on. We were driving around. We both were wearing masks in the car, and we're sitting there looking outside of the windows, saying, "Look at these people just cold swaggering around." It was Mazunga down. It was Mazungas all day, but no masks, walking around. And this is in New York, and then Cuomo then got on. He got on Monday and was like, "Listen, how would what was that movie, Bronx Tale? I'm gonna have this bad boy such that now you can't leave." He was saying he was gonna shut the whole son of a bitch down. I mean, he was gonna start locking shit down. Because apparently that must have got back to the governor's office or whatever. But he went ham. He went ham on Monday. So people are playing. They're playing a lot of. They're running it real risky. They're playing a real risky game. And Mike's hitting it right in the head. The Mazungas in this article is just showing you they don't care, man. These guys, they're not giving a damn. They are out here, just rolling like there's no tomorrow. And I guess maybe for some that's how they feel. So maybe there is no tomorrow for them. So they're saying fuck it. But that's what's going on here in Westchester County. Folks operating like it's fun times at Ridgemont High, man. For real, it's crazy. It's crazy. I cannot explain any of this. It's beyond explanation. I can't explain it. Just can't explain it.
Yeah, this last item on the docket is from Nature.com. Millions of Black people affected by racial bias in healthcare algorithms. Study reveals rampant racism in decision-making software used by hospitals and highlights ways to correct it. Yeah, I'm not going to read this article because somebody has sent from LinkedIn. Black people with complex medical needs were less likely than equally ill white people to be referred to programs that provide more personalized care. Okay, you know, you got law enforcement. I mean, you got law enforcement putting needs in people's backs. You got, you know, healthcare systems that fail to prevent a pandemic, also impacting Black people. You got redlining going on, and you know, the housing market and the credit card industry and Wells Fargo and all this. I mean, Black people are battle fatigued, man. They're battle fatigued. That's why they, you know, they're so outraged, man. There's a lot of things that went with this you know, this George Floyd case, man, that caused this explosion of resentment and anger, and the desire for regime change. This is a part of the issue. This is a part of the issue, man. Compounded with a myriad of things. I can't breathe, you know, which is a good image that we just saw, describing that very thing. So I don't know if anybody else has anything they want to ask before we close out.
Yeah, just be careful. Take care of yourself, people out there. Just be very careful. Take care of yourselves. Don't take any unnecessary risks. Certainly, if you don't, and just prepare yourself and take care of yourselves at all times. That's just it. You know, don't get too loose out here. Don't think this thing is over, because it's not.
Yeah.
We're living in a time now when there's nobody more important than you. If your son or daughter endanger your life, I mean, that'll tell you something. You see somebody who will say, you know what, I want to leave home and go outside. I remember early on, one guy, I think he's in California, refused to let his son in the house because his son went out some partying with his friends. And that's what you got to do.
Jadzilla, you going to say something?
Yeah, no, just piggybacking on what Nagone said there. Take care of yourselves. Again, be careful. We know we understand the earliest incubation time of this thing is 2 weeks. I'm not going to say yay or nay on the protest, but a con is going to be this increase. So, you know, all those people out there together, whether for a good reason or however you feel about it, it still has a negative effect of the potential to cause a serious spike in this. So be leery if you have been in those protests, or if you're aware, or if you're around people who've been in those protests. You got to take your precautions. You really do need to take your precautions to protect yourself, your family, and your loved ones. Um, and and again, just, you know, just common sense. Utilize common sense. If you don't have the common sense, then actually do a little bit of research. You know, try your best. That's all I can say. Sorry. I think Mike expected me to be a little bit more long-winded. Yeah, yeah, no, I get a couple of margaritas, and you know, it starts. You know, I start to run off.
Nah, nobody else has anything else, man. We can call it a night, man. I see one question in the chat. He says, "Has anyone hit the gym at all?" Yeah, I'm not seeing too many places open up, you know, gym wise, man. I'm seeing more people work out outside. So, and plus, you know, people. I went to a Dick's Sporting Goods Sunday. Nothing is in stock. Everything is sold out.
Everything is back order. I've ordered dumbbells and my lifting bench. I actually bought a nice Rogue lifting bench, and it cost me a couple of bucks, but I'm waiting for that bad boy to come in here. They're telling me maybe 6 weeks, maybe earlier, but it could be up to 6 weeks for a fucking bench, bro. So
but
it's like,
try those cables, man. Try those elastic bands, man.
yeah. But
He can't do.
I got to get up underneath my DBs, and I'm waiting for those to come in, you know, and I'm getting up a set of $100-30s, and 70s and 50s. So I'm gonna have you know, some graded weights here, and I'm just waiting to get stuff in, and this is all taking a while. Everything's on back order, man. So everything is on back order, and I didn't anticipate this coming down, of course, like many other people didn't, but I wish I had ordered a lot more of my gym equipment a long time ago, and everything's on back order, so nothing's coming through here quickly. So I got a nice sizable garage and nice sizable basement, but I'm going to I'm gonna be getting back savage again. But yeah, it's gonna take a while, you know, just to get gym equipment in. It's crazy.
Ain't no going. You gotta do like the brothers in favelas, man. You gotta put some cement on those bars, bro.
Yeah. They're doing that. They're doing that in Ghana too. They got.
All you need is PVC pipes, cement, and wood, man. That's all you need.
Yeah. Hey, listen. I've seen it. I've seen those guys put stuff together, and they built some. They gotten pretty swole on it as well.
Oh yeah.
So yeah, I've definitely seen it. But I figure these guys already have it made. So so I'll go with the prefab stuff. So.
Yeah, let me close out, man, because we don't have anything else going. But yeah, thank you all for everyone that joined the panel and contributed. And please hit the like button if you've not already done so. Share the video if possible, and hit that notification bell so you get all the updates from the Black Brain Trust, those posted on the community tab. Shalom, everyone.